Hello, my name is John Rees. I'm a chiropractor at Ilkley Chiropractic Clinic in West Yorkshire. We're currently doing a series of short lecture videos to attempt to educate and inform the public with regard to chiropractic and the sort of do's and don'ts and the things you should be aware of when considering consulting with or going for your first chiropractic appointment, because there are a few little idiosyncrasies that you may not expect to occur, and we don't want you to fall foul of unknown pitfalls, if you like. Now, some of you will have wondered whether you should see an osteopath or a chiropractor. Ostensibly, they're very, very similar. There are a few differences which we won't go into in any specific detail here, but for the purposes of this video, one of the main differences is that chiropractors are trained to take x-rays, musculoskeletal x-rays, and therefore to use the x-ray equipment, and also consequently and subsequently to be able to read those x-rays. Osteopaths aren't trained in such a fashion. However, just because we as chiropractors have been trained to take x-rays does not make it incumbent on us to take x-rays, particularly at every initial consultation. X-rays are a particular assistance, they are a particular investigation, but they are not necessary in order for a well-trained, knowledgeable and experienced chiropractor to understand what is going on with your symptoms and to come up with a working diagnosis, and therefore illustrate to you and indicate to you a treatment protocol that will assist to reduce your discomfort or your pain, or to improve your activities of daily life so you get back to a normal situation that you wish. So as I say, x-rays are not at all paramount in assisting a well-trained, disciplined, knowledgeable, experienced chiropractor to understand what is going on. However, some chiropractic clinics almost require that at the initial consultation they take an x-ray of you. Now, of course, as we just said, if you're well trained and knowledgeable and understand the correlation between symptoms and signs and symptoms, signs and conditions, and do the appropriate history taking at the initial consultation, followed up by subsequent examination, particular to what the patient has told you, you will come to a very clear working diagnosis. A diagnosis that in the vast majority of cases is all that is required to facilitate a professional and appropriate treatment regime thereafter. There are some very rare occasions when signs and symptoms don't match up, or after a short period of treatments, the working diagnosis and how you're treating isn't going as one expected, that you might, and I say might, consider another investigation. That could be an MRI, which is not within the remit of any chiropractic clinic to take on site, or x-rays that can be taken on site. So, ask the question, be cautious if at initial consultation a chiropractor recommends an x-ray. Many of us would see a recommendation at initial consultation of an x-ray as undertaken for one of two reasons. Either because the chiropractor is kind of admitting that he or she does not have the necessary expertise or knowledge or experience to correlate between your symptoms, the signs taken from the test, and possible diagnoses, and therefore needs more information, or it might be a money-making exercise. Obviously, X-ray equipment is very expensive to invest in, and one would wish to get a financial return for that. If it is either of those, one would perhaps question the proficiency of the individual that you're consulting with. Also with X-rays, although this does not normally happen within the NHS, which is incorrect, X-rays show you all that's in front of it, so from front to back. And taking one X-ray does not put everything that can be seen on that X-ray in place, because it's an X-ray, so it goes through everything, so everything that's in its way is seen on one 2D image. You therefore necessarily need another image which is perpendicular at 90 degrees to the first image, so that you can put in appropriate layers, if you like, what you've seen in the first image. Now, in the NHS they don't do that, they just take, or generally speaking they don't do that, which they should do, but they don't, because of course it saves them money. Sometimes what can happen, and it happened to a patient of ours recently, they took one X-ray, they didn't take the perpendicular X-ray, and a fracture of the pelvis was missed because they didn't take the other X-ray. So it has always been clinically really necessary to take two X-rays. So if you're going to a chiropractor who recommends an X-ray, that means you will have a minimum of two X-rays, which is exposure to X-ray times 2, which is not necessarily the most appropriate thing one should or could experience. And as we've just said, the reason you don't usually need an X-ray is because, depending on your presenting symptoms, the chiropractor will, at the initial consultation in the history taking, ask you very pertinent questions relevant to those symptoms you have presented. From the answers you give to those very specific questions, that will direct the chiropractor to particular examinations to verify his or her notions as to what your diagnosis is and what the nature of your problem is, consequent to what you've told them already. And in the most situations, the findings from the examination correlate with the history taking, and therefore the chiropractor is well aware of what your problem is, and no other investigation is necessary. If once the chiropractor has come up with a working diagnosis and a number of treatments have undertaken, and I mean 4 or 5 or 6, and there is no alteration to the patient's symptomology, it might require or consideration of an investigation, or it may require an amendment to the treatment protocol. Oftentimes it is the latter, and when you slightly amend the treatment, oftentimes the results and the positive outcomes for the patient become apparent after a few more treatments. One thing that a prospective new patient should be cautious of when they look to register or go and see a chiropractor who will advocate X-rays is to ask whether the initial consultation fee includes a treatment. Oftentimes it doesn't include the treatment. You're really just paying for his or her time and the cost of the X-ray. Clearly, most people don't, as soon as they get some discomfort, rush to a chiropractor. It's something they have often lived with for a while. So once they've got the initial consultation, their expectation is that treatment will start at that moment during that first meeting, and therefore one hopes that your situation will improve thereafter. So make sure you ask if there is a treatment as part of the initial consultation and part of that initial fee. Also, what appears to be the case for with a number of chiropractors who do advocate x-rays is that they will also look to sign you up for a multiple number of treatments, and therefore you pay for a package. Can be 10, can be 15, can be up to 30 treatments that you pay for at the initial consultation or soon thereafter. And the argument given is that, well, if you pay for 30 treatments, we'll give you a discount per treatment. The fact is that it is most usual not to require as many as 30 treatments from the initial consultation. Oftentimes 5 to 6 treatments, 8 to 10 treatments from the initial consultation is more than enough to facilitate an adequate and satisfactory improvement to the patient's well-being and to enable them to get back to their activities of daily life. It may, as a consequence of the situation the patient gets to after 8 to 10 treatments, be an interaction or a discussion in relation to ongoing treatments intermittently to maintain the situation. But it is very rare for a patient to need 30 treatments from the onset of their problems. And of course, if you've signed up for them and feel duty bound to turn up, it's quite a costly exercise paying for 30 treatments when you may be to a satisfactory level of improvement after 8 to 10 or 10 to 12 treatments. So be cautious of someone who's looking to give you a discount based on the numeracy of treatments, as in fact you may end up paying more than required because you're paying for treatments that you may not necessarily need or benefit from, but think you are getting an advantage because you're getting a discount. Okay? Now obviously we have made this video based on our 25 years of experience, both on how we have treated patients and the outcome of those patients, also our experience having been commissioned by the NHS, one of very few chiropractic clinics that have ever been commissioned by the NHS, and our audited outcomes as a result of what we do to our private patients and NHS patients. We obviously cannot be categoric in everything we say, because in this day and age people are very nervous about being unduly open with opinion and information to the public. This is provided to give you an indication and perhaps to make you conscious of certain questions you need to ask when you're considering one chiropractic clinic over another, because they don't all act with the same protocol, they don't all act with the same financial situation. We hope this is helpful to you. If you would like any more information particular to what we've just spoken about, please feel free to call us on the numbers and information we're providing here. Otherwise, thank you so much for listening, and we look forward to presenting to you once again soon. Thank you. Bye-bye.